Our time right now is 7:39. Dr. Kevin Kavanagh is a retired physician, also the founder of an organization called Health Watch USA, and he joins us now. Dr. K, good morning.
Good morning, Jack. It was very good. Sheltered at home and read the news, watched TV, talked to grandkids over Skype. That's about all you can do right now.
Good, man. That's good. There's nothing wrong with that. I understand that you mentioned this in a text you sent me last night that President Biden is going to impose a travel ban to South Africa due to COVID-19. Is that correct?
That's correct. And that has to do with the South African strain. And that strain is much more worrisome than the UK strain, which is the strain which we think is going to overtake the United States by March. The South African strain is also more infectious than our original virus. It's currently in about 20 countries. But the thing that really concerns people is that they feel it will be able to evade our monoclonal antibody therapeutics. In other words, that's that drug we've been talking about, that if you get a positive test and you're high risk, you want to go to the hospital and get this. But it will also possibly make the vaccines less effective. And so that's really not a very good thing to happen, and it's not a good sign. One of the things that really worries people is what's happened in Brazil. Now, Brazil has a different strain. It's kind of came about through a different mechanism, but it has very similar mutations as the South African strain. And in Brazil, there's a city of Manaus that early on in the pandemic was overrun by COVID. And it is estimated that 76% of their population became infected and became immune, and the infection went away. In other words, they felt it was an example of developing herd immunity. Well, unfortunately, they've now had a second wave that's even larger than the first that's caused by this Brazilian variant. And so that kind of puts the last nail in the coffin of herd immunity, because this variant looks like it's going to cause reinfections. Now, that doesn't mean it's going to be resistant to the vaccine. Remember, with the vaccine, you actually mount a higher immunological response, a longer response than what you would get from an infection. And of course, you get the vaccine twice instead of once. So the vaccine is still in play, may reduce the severity of the infections, could give you immunity. They don't know for sure, but they don't think it's going to leave you completely without any defense against that variant. Nevertheless, it's not good news, and it's something we want to keep out of the country. In addition, it underscores President Biden's efforts to, one, get the National Defense Production Act up and running, to get us N95s, which are better masks to prevent viral spread, and to get our overseas efforts going again with CDC having boots on the ground. Remember, there's been dangerous viral infections have propped up around the world all the time. Look at Ebola. CDC would have people on the ground. They would help snuff them out before they reached our shores. That's what we need to be doing.
Well, as if that were not enough, what about the UK strain?
Well, that's the one that's currently here that's going to be overtaking us. The very good news is that the vaccine looks like it's going to work. There's data out of England that the Pfizer vaccine will work. The UK strain is up to 70% more transmissible. They feel it may have a 30% increase in mortality. And there is some data coming out now that it may affect the young more than the original strain. So in other words, when that viral spike protein changed, and that's what the virus uses to attach to the cell, some are worried that it may have changed in a way that makes it more able to attach to children. We don't know that for sure, but that's something people are looking at, and one of the reasons why in the country of Germany, they've extended the closures of their society plus closures of schools, and they are mandating the use of surgical masks, which, as you know, works better than a cloth mask. So they've gone up one grade in a mask. Ideally, we should have everybody wearing N95s. I think overall there's a greater realization that this virus can aerosolize or spread by air, especially this new variant. So we really do need to up our precautions that we're taking.
Now, as far as closer to home here in Kentucky, yesterday The positivity rate was down to 10.24% from 11 something before. So at least we're going in the right direction.
Oh, yes. In fact, one day it was up over 12. So we're going in the right direction. Our cases are going down. Hospitalizations look like they were going down. Deaths are still very high, but remember, deaths are lagging indicators. And it's kind of curious that people are still confused about that. But remember, in the beginning of the pandemic, when the infections were very high, but we didn't have any deaths, people thought, well, things are fine. Well, they weren't, but you couldn't convince them. Now it's kind of the opposite. The deaths are up, but in Kentucky, our cases are going down. And that means that things are actually going better than what they were before. But we need to keep this UK variant out of the state. We don't need to be spreading it, or we may get into another severe surge.
Always a pleasure, sir. I thank you very much.
Thank you, Jack.